find it be the most effective if I just had to pick one, which I would hate to have to do because certainly this doesn't work on everybody, is the calcium channel blocker nimodipine, also called Nimotop. This works much better than any other calcium channel blocker because it's so fat soluble. It gets into the brain really well and it gets into neurons really well. Much better than any other calcium channel blocker. And when it works in a patient with chronic fatigue syndrome, this is what happens. They feel relaxed. All of their compromising center points either go away completely or they get much less tender. They have more energy. They're more alert. They don't have as many memory problems. They can read better. And I've had people with developmental learning disorders, what used to be called dyslexia, have that apparently go away in about half an hour after they took nimodipine. Nimodipine is used for lots of other things besides brain hemorrhage, although it's not used by very many doctors yet. And so I would certainly add neurosomatic disorders to it. In the next 10 years or so, we're going to learn a lot more about what goes on inside the cell when you stimulate a receptor. Because one of the reasons that we can't make you better more readily than we do is that we can't really have much of an effect on all of this stuff. One of the things that the field does is that it increases this. This is called an immediate early gene, and it's a sign of a cell being activated. And when you put a drug like Nimotop into here, this doubles or triples the amount of the immediate early genes that are made. And so this could be one of the mechanisms that we're seeing when I treat these patients. We've also been pleasantly surprised when we do pre and post neuropsychological testing. We do the test and then we have them take medication, then we do it again in an hour. And we have people frequently double or triple their scores in an hour. Now, people at the NIH tell me that all that I'm seeing with all of these things that I've been talking about here is a placebo effect. Really? And then I say, well, then it looks like I discovered the mechanism of the placebo effect then. We're also doing a technique called magnetic resonance spectroscopy, where we can measure certain chemicals in the brain. and at least we won't have the old data analyzed until next month, but it looks like the dorsolateral prefrontal cortex has low glutamine in people that have Fibromyalgia syndrome. Last week I began to do magnetic resonance spectroscopy pre and post-treatment, along with pre and post-treatment brain specs, so that we can see how changes in the chemicals correlate with changes in blood flow. No one else in the world is doing anything like this, but I don't know why they're not. And then we have a new way to display brain spec findings. This is how we display brain specs now. And this is the front of the brain, this is the back, these are the sides. And you can see here, this is the dorsolateral prefrontal cortex, and this is the intertemporal lobe. And we're talking about the circuit here not working right. The blue areas are the areas of decreased blood flow. And here it is again in another patient. And so, rather than just seeing it as balls of color, you can see it now sort of on a real brain. And we get a higher resolution too, so that we can look at other areas that might be involved in neural network dysfunction that we couldn't see as well on the brain specs that I've been showing up until now. And that's all I have to say. Thank you for your attention.
Agreed to have question and answer time, and I was so happy that everything was going as scheduled, and all of a sudden I realized I don't have a microphone to go out into the audience. So what I'll do is I will just have a few at a time come up here and stand in line and ask their questions so that he can answer it over the mic.
Did I understand that this malfunction of the limbic system happens when the brain is forming or maturing? Now, is that what it says? And how long is that for?
That could be one of the ways that it could happen. There are lots of ways that your limbic system and your dorsolateral prefrontal cortex might not work right. It could be genetic. It could be as a result of childhood experiences, and then it can be triggered by lots of things. Viruses, environmental toxins, head injuries, having surgery with general anesthesia, having a baby, not having enough sleep, being in an auto accident, different kinds of stress, and maybe even electromagnetic fields. But if you were strongly genetically predisposed to get this, you might not have to have had any of these things, and you could have just more or less been born with it. From the rat work, where the rat pups were separated from their mothers for very brief periods of time after they were first born, it looks like, at least in very young rats, it doesn't take very long at all for lifelong changes in brain function that happen.
I read another article that indicated that this was a progressive disease, and if so, what are we talking about? It just mentioned it that they considered this progressive, but nothing was elaborated on. Is that
For the vast majority of the patients, they feel that they're worse than the first 6 months. And then they start to get a little bit better. It's rather unusual that a patient should just get worse and worse and worse and worse and worse. That would be rare in my experience, and I've seen about 4,000 patients with this.
Do they take the medicine the rest of their lives?
In a way, it's like treating diabetes. If you need the medicine, you take it. As I said, we don't have a cure for it. Some people do get better on their own, and then they don't have to take it anymore. But it's kind of hard to predict to whom that's going to happen, and I don't know why some people get better and some people don't. But for many people, this is a lifelong illness, and they're treated.
And I have another question. What do you do for sleep disorder? My worst problem is sleep disorder.
Most of the medications that I use help sleep too, because it's not being able to sleep. Usually you have what's called a disorder of initiating and maintaining sleep. It's hard to go to sleep and then you wake up a lot. Some people kick their legs around a lot at night. And if they do that, there are three main ways to treat that, because that can be rather exhausting to a person. You can use a drug called Klonopin, which is very, very effective for that. You can use one called Cinemet, which is used for Parkinson's disease, or you can take a Darmon before you go to sleep, and that will stop you from moving your arms and legs around. Most of the drugs that I use here will make it easier for you to fall asleep just in and of themselves. If they don't, you can try things like an extremely low dose of Cinequan, which comes in an elixir, so that you can just take 1 or 2 drops of it. You can take a very sedating antidepressant called trazodone, also known as Desodol. Some people don't like that because it gives them a hangover the next day. Or there's a new sleeping pill called Ambien, A-M-B-I-N, which is very effective. It's not habit forming, and it's very safe. It doesn't work on everybody, but if it works, it's very helpful. But the large majority of my patients don't need to take anything to go to sleep with, because the treatment that they have helps them to sleep more normally.
I understand that more women are affected by both as well by CFS than men. I'm wondering what the percentages are,
and if you have any ideas concerning why they are that, and also ages involved in both maladies.
Women's brains are different than men's brains. They have different sizes of various anatomic structures in the brain, and they respond differently to certain hormones. And so I'm for equality as much as the next guy, but they're just different. The mean age of onset is about 35 years old. Although I have 5-year-old children in my practice, and I just saw a lady on Friday who was 84 and had had this for a year. She felt better when she left. And probably I would say it's about 2.5 to 1 women over men.
I think you've answered a lot of my questions, but what I'd like to know if there's any hope of a recession. Now, 5 years ago, I could play golf, I could swim 20 laps, I taught my grandkids to learn how to swim, and now I'm so weak I can hardly walk. And in pain, terrible pain. I could take pain pills some days and face. I think I could take them and they help me. I imagine probably a lot of these people have very same thing, but if you think, I'm anxious to get to swimming with you. My mind's gone to my mind, but I just wondered about you saying that exercising is not the best thing for me.
Okay. Well, this has been hotly debated about whether you should exercise or not. Fibromyalgia doctors make you exercise no matter how much it hurts you, but the chronic fatigue doctors usually advise people to not exercise very much because they relapse so easily. I try to avoid the controversy by making them feel a lot better, and then they can go and do exercise. I don't have to get involved. One of the problems that I've had is when people feel better, they sometimes forget that they're still sick, and that they still have limits to what they can do. And if they exceed those limits, they're going to relapse, even if they're taking these medications. Sometimes when that happens, the medications that they've been taking don't work anymore. Many of the patients that I see had been very involved in exercise, triathletes and things like that, prior to getting sick. In fact, marathon runners very often get a flu-like illness that lasts for about a week after they exercise. And so this guy was a triathlete, and when he came to see me, he could hardly do anything, and I got him feeling a lot better so that he could do 10K runs again. And so one day he came in and he said, well, I'm going to go climb Mount Whitney this weekend. And I said, look, you've gotten a lot better here. Don't you think that that's taking too big of a risk? Because mountain climbing is very strenuous. And he said, I don't care, I just have to do it. I don't care what happens, I just have to do it. And so he had to be airy back off the mountain halfway up. And that was about 3 years ago. And he's not been able to work for 3 years. And he was back working and doing everything until this last treatment that I tried to really help him along. But he was 3 years almost in bed the whole time after he did something stupid. And so if you can get the feeling well enough so that you can go back to work and have some kind of family life or some kind of social life, don't push it. If you want to increase your level of activity, just do it very, very gradually, and then see what happens. Don't do it all one time, because sometimes while you're exercising, you don't know how bad you're going to feel the next day. And so do it very, very gradually when you increase your level of your activity, so that you'll be able to tell what your new limits are, and then don't exceed them.
Thank you. There is no cure so far for this disease, but in the government help, are the doctors trying to get the government going like they do for cancer and all these things to help them?
I must say that the government is clueless.
My question was about what do you know about children with fibromyalgia and Crohn's, and do you prescribe the same medicine or different ones?
This is a rather widespread illness in children. Their brain specs look about the same as they do in the adults. They're usually diagnosed as having what's called quiet ADD, or attention deficit disorder without hyperactivity. But they don't feel like doing anything, and they fall over, and they don't want to go to school. They may be diagnosed as being school phobic because of that, and they respond probably better than adults did to the treatments that I've outlined here. But it's very, very underdiagnosed in children, and it's high on the list of reasons for poor school performance.
I kind of have a two-part question. The first one is, I'd like to know, I've been seeing a rheumatologist for a while about this problem, and what kind of doctor do we need to see if this isn't a muscle-related problem? And do you have any network of physicians that are in this area that have gone over to California?
Well, I'm sort of sorry that the rheumatologist ever got involved in this, because they know a lot about joints and muscles and the immune system, but they don't know anything about the brain. And even the ones that I know who are trying to learn, there's a lot to know. No, I don't think that rheumatologists should be treating, I think that that's inappropriate. I don't know what kind of doctor should. You have to know about so many different things to be able to treat this. Ideally, a psychiatrist that had a good background in internal medicine and behavioral neurology would be the best one to do this. but there aren't any of them. So I think that maybe the best thing for you to do, which I'm sure that you've all tried to do, would be to try to educate your family doctors. Because at least they're used to treating the whole person rather than one organ. But if I think that there should be a residency just for this kind of illness, because it took me a really long time to learn what I just presented to you here for 2 hours. It took me 10 years to learn this. Now, I could teach it to somebody a lot more rapidly than that. But it still requires a lot of information. And right now, nobody has it. There's a doctor in Seattle named Charles Thompson who pretty much follows my protocol, although he does a lot of his own things. I don't think that he does all the things that I do, but he does some of them, and he's been reporting good results with it. And so he can come and try, and I know that Dr. Stratford here does it, but he's kind of busy.
Where in Washington?
Seattle.
Okay.
He's a pain specialist. Charles Thompson. Yes, he's a private practice. In New York, I would suggest that you see Susan Levine. She has a different kind of practice than I do. She sees people very rapidly, and she's an immunologist, but at least she's open to the things that I do. She's in Manhattan.
Yes, the only question I have is not really a question, it's more of a concern. When I was small, I was treated for ADD, and they gave me Revlimid. And after that, I quit taking it, and I started getting into speed. And I did not have a problem with depression or ADD when I took speed. The only problem was that ultimately I got hooked on it. And so now I'm very concerned about the medications, whether, if they're drug induced or not, whether they're good for me or not, being a recovering drug addict. That 2 years ago I was diagnosed with clinical depression. And although I'm not suicidal or the depression is lighter, I still have the chronic fatigue and the aches and the not being able to sleep at night. And one of the things I noticed in the booklet that Zoloft wasn't mentioned, and my physician has diagnosed me with my fibromyalgia, that they have given me Zoloft and trazodone and amitriptyline.
What book?
I noticed the little booklet that said antidepressants, that said Prozac and,
Well, certainly, the one that's on.
is that Zoloft?
Yeah.
Oh, okay. Because I don't see any.
I have a number of people who have had drug dependence problems in the past, and they respond just as well as anybody else does to this list of things that I do. I don't really treat them any differently than anybody else.
So I guess my question is, it seems like these are not addicting,
No.
but they don't seem to be helping. I mean, I'm not suicidal and I'm not
Well.
having severe depression, but I'm still the aches and the lack of sleep.
Why don't you ask your doctor to try some of the things that I recommend here today?
Okay, so then my other question would be, is this addicting?
No,
It is not.
none of the drugs that I listed today are have pharmacy.
Thank you.
when you showed the charts on the oxygen levels themselves, and when you took this, what is it? They took it and it didn't increase the oxygen level, it didn't appear to on the chart. What will happen long term if this doesn't get increased? Or does this eventually increase it after taking it? You're not getting a good blood flow to the brain.
The brain has a lot of reserve as to the degree of decrease in blood flow that it can tolerate. And so you can decrease brain blood flow 60 or 70%, and the brain will still have enough blood to do what it needs to do. And so what we're seeing here is not due to decreased blood flow, but it's due to metabolic dysfunction in the nerves and in networks of nerves. I've had people taking nimodipine for 6 years without any apparent problem.
I was wondering if the ampicillin is available for treatment. I didn't notice that.
You wouldn't want to give someone endophyllin because it would raise their blood pressure a whole lot, because it's a vasoconstrictor. And so what you would want to do would be to modify the endophyllin molecule so that it would have the effects on the brain without having effects on blood pressure. And there are several companies that are working on this now, but that'll be far in the future, I'm afraid. Well, it would be more realistic to try to find other medications that increase the release of or the biosynthesis of the endophyllin that you already have, because it'll be at least 10 years before you'll be able to give someone artificial endophyllin that wouldn't raise the blood pressure real high.
And guys, how many treatments are most people on? Are they on one medication, 2 medications? Is there an average?
I'd say that my average patient is on 2 or 3 medications.
One question. You said that the cortisol level did not go up when the exercise with chronic fatigue syndrome. Does it go up with fibromyalgia? Or neither one? Or the blood flow? Okay. Why do I feel better after exercise? Placebo effect?
People are different. And what exercise does to your brain might be different than what it does to other people's brains.
True. I feel worse after exercise.
Well, I can't overdo it, that's for sure. If a person continues to get worse in their course, would that perhaps indicate there was something besides?
It's extremely unlikely that someone who's been diagnosed with chronic fatigue syndrome after 2 years or so will be found to have any occult disorder that would be accounting for the symptoms. Patients have been followed for a long period of time to see if they will develop any new illnesses or whether they would show themselves after years that would be responsible for the symptoms of chronic fatigue syndrome, and it just doesn't happen. That's a very rare event.
My question is, I see a lot of, I guess, what I call duplication in terms of the symptoms between chronic fatigue syndrome and fibromyalgia. How do you differentiate? And I have another question too about water aerobics and exercise.
For all practical purposes, you may as well hold the same thing.
My other question was about water aerobics. That seems to be a big thing where you have support in the water. Is that any different in terms of the exercise and the changes?
I don't have an opinion about that. As I said, my approach to exercise is to make the person feel better and then have them go do more exercise.
Covered the questions, but I don't see. Okay.
Any thoughts about diet?
Diet. Okay. Many patients that I see have multiple food intolerances. They can't eat this, they can't eat that. This makes me feel this way, this makes me feel that way. And they turn out to have very restricted diets. If you just want to treat it with diet, you can use a thing called an elimination diet, where you start with maybe just eating rice, lamb, and maybe bananas, and then add things onto your diet to see what makes you sick. I think that this is too much trouble. And so, usually when I see people whose main complaint is having food intolerances, I just help them to feel better, and then I have them go and have a Big Mac or some pizza. And they can usually eat pretty much anything that they want. The way that I think this works is that your gastrointestinal tract makes a lot of different chemicals when you eat something that go to your brain. And if your brain is not processing the information from these chemicals properly, you'll feel weird after you eat certain things. Certain foods also have chemicals in them, like nitrates. Some of them have things like endorphins in them. Some of them have things like benzodiazepines in them. And so they can make you feel bad that way too. But when one of my patients gets a lot better, he or she doesn't have any food problems anymore.
Dr. Goldstein, there's someone in the back that wants to know if there is any, if you feel there's any benefit in taking niacin or any danger in taking it.
No.
Thank you.
Are there any vitamins that you do or you
Vitamins.
vitamins?
I think that vitamin C and high doses can help some people. It works in the brain kind of like an antidepressant does. And it also, it will increase the secretion of glutamate. Vitamin C is co-localized with glutamate in lots of the neurons in the brain. I don't think that any other vitamins are that helpful.
How much of a dose?
It perhaps works the best when you take it intravenously and very high doses, but that's very controversial. I don't really use this anymore because I don't have to, but if you want to do that, you should take it to the point that it gives you diarrhea and then decrease it a little bit.
What about glutamic acid? I took it once and it seemed to help for about a week and then it stopped helping.
It's really hard to change the levels of most brain amino acids by taking them orally because they don't get across the blood-brain barrier very well unchanged. And so I don't generally advocate doing that.
I read in a newsletter from Seattle that some people were taking magnesium, calcium, and zinc, and that was helpful. Would you?
Well, that's not really been my experience that magnesium is very helpful in neither calcium nor zinc. For a while there was a craze that magnesium would help people, and I gave them IV magnesium injections and stuff. Was not impressed with the results, and I don't do it anymore. You?
Talk about that exercising seems to be a problem, and I realize that has a lot to do with your weight count. How does it, when you get your treatment, are you able to exercise enough to cause that, or does this help you with the problem?
Well, you gain weight because your brain doesn't regulate your brown fat metabolism right. Your brown fat is the kind of fat that radiates off excess calories as heat rather than turning them into fat, and that's regulated by your brain. And often when people feel better, they lose weight. This has to do a lot with hippocampal cortisone receptors, and if you could block them, you would lose weight. But we don't have agents right now that can do that. They're still experimental. But I think that when they become available, that they'll be great for weight loss.
But the treatment does help that too.
Yeah.
Feeling better will help the brain.
Yeah.
Do you see many patients who complain that the weather is one of their very big
Oh, sure. I think that the limbic system responds to barometric pressure. And that's why with fibromyalgia can tell you when it's going to rain. And yeah, it's real common.
Did you practice feel that, or is there a long waiting list?
Well, I don't want to advertise my practice here. So yes, looking new patients is not very expensive. If you come from usually out of town, you better plan on staying a week.
Is this possible? I mean, or is there a long wait?
Well, there's a waiting list, but it's not real long. It used to be 6 months before there was managed health care, but now that there is, it's gotten a lot less.
Correlation in this and having less fat fillings, some doctors.
I don't really think that there's too much of a relationship between chronic fatigue syndrome and amount of fillings. I've had too many patients have them removed and it's not helping at all. So I don't advise doing that.
I have a comment and then a question. I got my fibromyalgia from the swine flu shot. 8 days later, I was a mush ball. And it took me 15 years, and then I got a setback. And I heard you mention
allergic to all kinds of chemicals and perfumes. Could you comment on that, please?
It's relatively common that people become fatigue syndrome after they get immunizations, or that they get relapses after they get immunizations. Your limbic system really lights up after you get a vaccination. And it gets very activated and secretes a lot of chemicals, particularly serotonin. And if it's already on the verge of being dysregulated, this can tip you over into having overt illness. I advise my patients not to get any immunizations unless they absolutely have to. With reference to chemical sensitivity again. People have a more sensitivity to low-level chemical exposures. This is, as I said, it's called capsomia, C-A-C-O-S-M-I-A. The way that this works is that the nerves from your nose that go right into your limbic system, they don't go into your thalamus first. And they're the only nerves besides your face nerve that do that. And so if the gain on your limbic system is set too high, then you could smell something that would bother somebody else, and it would make your limbic system go wild, and you would feel lousy. And so that's how I see that.
And a question about the treatment I'm being given now, which I just started, which is IV vitamin C, 25 grams, pantothenic acid, 2 cc's, and calcium, 10 cc's, and 500 sterile water, plus Cortef 3 times a day, plus B12 shots. The first is the crux of it. I can't tell any difference yet.
Well, like everything else, IV vitamin C works for some people and it doesn't work for other people. Usually it works rapidly, but you have to take it every week or two. It's sort of expensive to get IVs. I don't do it too much. Huh?
What? You said something you have.
Well, I don't do it because I don't have to. Because the other things work. Yeah, I would rather give a person a fairly inexpensive pill than I would have them come to the office every week to get an IV, even though I would make a lot more money that way. I don't think that there's any place for giving cortisone in this. I think that it would make you worse if it would do anything. If you have a low corticotropin releasing hormone anyway, and you give cortisone, that will make it lower. So I don't think it's a good idea to do. As far as B12 shots go, I think that they could be a good thing. They could work as a methyl group donor, like a drug that's been in Europe for about 10 years called S-adenosylmethionine, which is a good antidepressant and has been shown to be helpful in 2 double-blind experiments on patients with fibromyalgia. And so that's why I think that high-dose vitamin B12 injection would be okay, but you usually have to give them every day or two. And I don't like people to give themselves injections unless they have to. And they you usually don't work great, they just work a little bit. And generally, I don't think it's worth it.
Last question. Have you found any correlation between fibromyalgia, chronic fatigue, attention deficit disorder, and autism? Or do you believe that possibly someday we may find there is a correlation?
There is a correlation with attention deficit disorder where there's no hyperactivity. The brain specs of people with hyperactivity look different than the ones without. As far as autism goes, why don't you ask me in about 5 years? I just don't have enough information right now to respond to that.
Thank you all for coming.